What happens is if the patient comes in and they're tested for influenza, and if it comes out influenza A, then they have to meet certain requirements for them to be tested for the H1N1. The thing about this is we don't have the vaccine for it yet. And we're supposed to get that sometime in October is what we're told. And then there may or may not be a shortage of it at the very first. But they have set certain criteria for the people who are to receive it if there is a shortage, which will be the children the age 6 months to 4 years of age, or anyone 5 to 18 years of age with underlying medical conditions. And those are the only patients that will receive it other than our direct patient care healthcare workers. Part of our respiratory etiquette program here, or hygiene program, whatever you want to call it, is that when the patient walks in, there are signs up in the emergency room and in urgent care that if they have a cough or anything like that, they need to tell the first person they see. We have masks for them, we have Kleenex, we have alcohol hand dispensers there, and they will instruct them how to use it and make sure that they get that on to help protect everybody. See, she's going to seal it off at the top, and then she's sealing it off underneath so that the air won't get through, and then she's protected. Washing your hands with soap and water for at least 15 seconds, scrubbing good, rinsing your hands well, or using the alcohol hand foam or gel, at least a quarter size, and scrub for at least 15 seconds and, get them dry. Cover your cough and use your elbow. The school children do that very well. Those are two of the main things, and then keep your surroundings clean. I mean, if people are coughing, clean off those areas because those droplets are contagious. And all you have to do is pick up a droplet and rub your eye or your nose, your mucous membranes, and you've given it to yourself.
If the droplet lands on plastic or steel, metal, it can live for 24 to 48 hours. If it's in cloth or tissue, it will live for 8 to 10 hours. And if it's on your hands, about 5 minutes. You can, after you're exposed to the swine flu, the symptoms can pop up in 1 to 4 days, but as long as 7 days before you start to show symptoms. Usually it's headache, and it's usually a severe headache, horrible muscle aches, fever. With the H1N1, it's a milder fever, 101, 102, but it's usually muscle aches, headache, fever. Sometimes the swine flu has produced nausea, vomiting. That is not common in seasonal flu, especially in the adult population. It's more common in children with the seasonal flu. The swine flu hasn't been as bad as the seasonal flu. Usually we can tell the difference because the swine flu people usually are sick for 3 to 4 days. Their temperature is not as high. They're not as achy. They don't feel as bad. With the seasonal flu, their temperature is extremely high, usually 103 degrees. They ache all over. Most people tell me that their hair hurts. The complications do come in the respiratory symptoms. What happens is the virus goes into the respiratory tract and it starts reproducing itself, which causes a sloughing of the respiratory tract, and then a secondary bacterial pneumonia sets in, and that's when people start to die, is when they get those secondary infections with the bacterial pneumonias.
They have brand new guidelines out, interim guidelines based on the H1N1 about the need for the pneumococcal vaccine. They have added asthmatics, and now we've always done asthmatics because that was our policy here, but they've added all cigarette smokers to that list too. So that's something that we feel like that's what people die of, is the streptococcus pneumonia, and that's what that vaccine is for. So if you take that pneumonia shot that's offered to you, then you have less chance of actually dying from that flu.
If you look back at 1918, the first round of swine flu then was not bad, and then it mutated, and then it became deadly. So we still don't know whether it's going to mutate. It may or may not. It may continue to be just like it is right now. We just don't know.